in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à...
Welcome everyone and welcome to this update on COVID-19 in New Brunswick. The spokesperson today will be the Chief Medical Officer Dr. Jen Russell and Premier Blaine Higgs.
Today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. Dr. Russell.
Good afternoon, everyone. The shape and the scope of COVID-19 pandemic is changing every day, and as the illness spreads and the path of contagion shifts, we must adjust our strategies to meet these new challenges. We remain focused on testing the right people, those who are at greatest risk for their own health and for the health of others. Our testing approach is being conducted in a manner that makes best use of our testing resources, et notre priorité consiste toujours à faire.
We remain focused on testing the right people, those who are at greater risk for their own health and for the health of others. Our testing approach is being conducted in a manner that makes best use of our testing resources.
We will revise our strategies to ensure that we are doing all we can to slow the pace of this disease so that our health system will not be overwhelmed by it. Today, there is an additional 7 cases to announce. And the breakdown is in Zone 1, an individual who is aged 20 to 30, which is travel-related, an individual aged 60 to 7, it's travel-related, an individual aged 60 to 70 who's travel-related. So that's in the southeast region, which is around the Moncton area. And Zone 2, which is in the south, near the St. John region, an individual aged 30 to 40, also travel-related. In Zone 3, which is the central western part of the province, which is around the Fredericton region, an individual aged 50 to 60, travel-related, an individual aged 60 to 70, travel-related, and an individual aged 60 to 7, also travel-related. The advice that I have given consistently and persistently over the last several weeks still stands. Stay home as much as you possibly can. Aujourd'hui, j'annonce.
Today, I announced 7 new cases. The breakdown is Zone 1, Southeast, Moncton region, an individual aged 20 and 30 years old, travel-related, an individual aged 60 to 70, travel-related, an individual aged 60 to 70 years old, travel-related. Zone 2, South, St. John region, an individual aged 30 to 40 years old, travel-related. Zone 3, Central West, Fredericton region, an individual aged 50 to 60 years old, travel-related, an individual aged 60 to 7 years old, travel-related, an individual aged 60 to 70, travel-related. The advice that I have given consistently and persistently over the last several weeks still stands. Stay home as much as you possibly can.
And I know there have been questions around what does it mean when you're self-isolating versus self-monitoring and whether or not you can take a walk and a breath of fresh air. We do have all that information on the website, so please check the website when you're finding out which category you fall into and whether or not you can get outside to get a fresh air and whether or not you should go for a walk and things like that. As you are all aware, this advice has the force of law under the Emergencies Act of New Brunswick. I support the government for the steps it has taken, including the setting up of checkpoints at our borders with neighboring provinces to slow the spread of COVID-19. I am aware of the seriousness of these measures and the impact they may be having on the lives of many of you, but these actions are absolutely necessary. We are acting according to defined best practices in public health and medical science. Our first goal is to identify those in our province who may have COVID-19, isolate them, and then isolate those with whom they have been in direct contact with. When we put that crucial physical space between those who have COVID-19 and those who do not, we are depriving the virus of the opportunity to spread more widely. By doing this, we are improving our chances of lessening the severity of the outbreak. Pour le moment, nous ne attendons pas à ce que toutes.
At this time, we do not expect to have all of the current measures in place today indefinitely or even until a vaccine is found. We know that the impacts of these measures are not sustainable over long periods of time.
to have all of the current measures in place today indefinitely, or even until a vaccine is found. We know that the impact of these measures are not sustainable over a long period of time. Our intention with the immediate measures is to delay a sudden increase in cases that would overwhelm our healthcare system. Other jurisdictions in other countries have successfully been able to lift measures after a certain point and return to a state of close to normal economic and social activities. We anticipate being able to move in that direction at some point in time, and it is dependent on how successful the current measures are over the course of the next weeks and months. Our planning processes currently revolve around what and when we will be able to change and adjust with respect to the measures currently in place. Please do not lose hope. We are all working very hard together to be able to get back some semblance of normal life for all New Brunswickers while awaiting a vaccine and viable treatment. This is why those who are returning from outside the province must isolate themselves for 14 days from the date of their arrival in New Brunswick. If they have unknowingly brought the virus with them, self-isolation will allow for symptoms to emerge without endangering the general public. We have asked that people monitor their symptoms and call 811 if they show the telltale signs of COVID-19, cough, fever, and difficulty breathing. But I want to stress that if you are experiencing symptoms of COVID-19, regardless of how recent your travel history or recent potential contacts, you must act as though you have COVID-19. Don't wait for a test result to put yourself in isolation for at least 14 days. Avoid contact with those outside your home. To date, these cases have been confirmed to be related to travel. But as I said, this is a dynamic situation which is changing rapidly. It is now clear that in several provinces there are clusters of COVID-19 cases contracted through community transmission, and these are cases where the chain of contagion cannot be readily identified or traced back to travel. We will adjust our strategies to meet this changing reality. Our testing will shift to protect our resources to ensure proper treatment for our vulnerable populations. Once community transmission is found, we start testing the symptomatic healthcare workers and staff of long-term care facilities and prisons, hospitalized patients with respiratory symptoms with no alternative diagnosis, residents of long-term care facilities and other vulnerable communities, symptomatic workers required to maintain critical infrastructure, and symptomatic travelers from outside New Brunswick. This will be based on resources available to perform testing, be it human, technological, or consumable, and for the need to provide results in a short amount of time. Again, this is only once we see community transmission. These are the groups that will be given priority testing. Nous devons protéger nos citoyens les plus vulnérables.
We need to protect our most vulnerable citizens, the elderly, the frail, and those with underlying health conditions. We must protect our essential workers, those who put their own health on the line every day to make sure we can continue to put food on the tables and maintain the necessities of life. And we must protect our healthcare workforce, the people whose skills and dedication may save your life if you become gravely ill. We can do this. It is not beyond our capabilities as individuals or as a society.
Most vulnerable citizens, the elderly, the frail, and those with underlying health conditions. We must protect our essential workers, those who put their own health on the line every day to make sure we can continue to put food on our tables and maintain the necessities of life. And we must protect our healthcare workforce. And I just want to mention that Vitalite and Horizon have been working very, very diligently, along with our partners at Department of Health and other government organizations, to really make sure that this is one of the utmost priorities, because these are the people who are going to look after us throughout this entire event. The people whose skills and dedication may save your life if you become gravely ill, these are the people we need to protect, along with the essential workers. So we can do this. It's not beyond our capabilities as individuals or as a society. The outbreak of COVID-19 may be stressful for people and communities. Again, this is going on for weeks and perhaps months at this time. So we really want to make sure that during the course of the next months, that people with fear and anxiety and really disrupted households and family life and rhythm and routine in their life This kind of overwhelming stress can cause strong emotions in adults and children. We want those people to be able to access help. So there is help available at the Kids Help phone. So you can talk to text 686868. You can call 1-800-668-6868 to chat with a volunteer crisis responder 24/7. The Province Mental Health Crisis Phone, CHIMO Helpline, 1-800-667-5005. That is also accessible 24/7. I'm also aware that the Red Cross is accepting donations for financial donations. They're accepting applications for volunteers, and I'm aware that they are providing support at this moment in time for people in need. So I want people to feel very comfortable reaching out to the Red Cross. It is natural to feel stress, anxiety, grief, and worry during and after stressful situations. Everyone reacts differently, and your own feelings will change over time. Notice and accept how you feel and take care of your emotional health during a disease outbreak. Just like in an airplane situation when the oxygen mask comes down and they show you that you need to put the oxygen mask on yourself before you put it on your loved one. So make sure you protect your own mental health and emotional health. During this disease outbreak, during this pandemic, while we're dealing with COVID-19, it will help you think clearly and protect yourself and your family. Self-care during stressful situations will help your long-term healing. This will not be over soon, but I'm convinced that New Brunswickers can get through this as we have gotten through so much adversity in our past. We will get through this together. Thank you very much. Merci.
Thank you.
Good afternoon. Bonjour.
Good afternoon.
COVID-19 continues around the globe. This outbreak is impacting New Brunswick residents and citizens significantly. Right now, layoffs in New Brunswick due to the pandemic are estimated to be between 25 and 30,000 individuals. We will have a better idea of exactly what the number is in May when Statistics Canada releases a more detailed report. We are facing a situation unlike anything we have experienced before. And I want to reassure New Brunswickers that we are acting swiftly to help families with their immediate needs and to bridge the financial gap for employers. Earlier this week, we announced we will provide an income support program for workers who have recently become unemployed. We
are facing a situation unlike anything we have experienced before, and I want to reassure New Brunswickers that we are acting swiftly to help families with their immediate needs and to bridge the financial gap for employers. Earlier this week, we announced we will provide an income support program for workers who have recently become unemployed.
Benefit of $900 administered through the Red Cross to workers or self-employed people in New Brunswick who have lost their job due to the state of emergency. This program will be a $4.5 million investment, and it is introduced as a bridge before the federal program or the A program kicks in. We are also introducing amendments to provide job protection for workers who must take a leave of absence due to the COVID-19 pandemic. This includes workers who have gotten sick, are caring for family members who are sick or instructed to self-isolate or quarantine. This will provide an unpaid leave of up to 15 weeks, allowing employees to take the time they need off work without fear of losing their jobs. As announced last week, WorkSafe NB will defer collection of assessment premiums for 3 months. The current interest rate is prime plus 3%. We are reducing the interest down to 0% to align with the 3-month deferral. While the federal government has announced comprehensive measures to support employers, there are still gaps for businesses to access the working capital they need right away to address cash flow shortages. That is why the provincial government will be providing $50 million in assistance to support our economy, keep our workers employed, and help our businesses continue to operate. We will provide this bridging support to assist small, medium, and large employers in the province in the immediate term. Bien que le gouvernement fédéral
While the federal government has announced comprehensive measures to support employers, there are still gaps for businesses to access the working capital they need right away to address cash flow shortages. That is why the provincial government will be providing $50 million in assistance to support our economy, keep our workers employed, and help our businesses continue to operate. We will provide this bridging support to assist small, medium, and large employers in the province in the immediate term.
The province will defer loan and interest repayments for existing business loans with government departments for up to 6 months. Businesses can request deferrals by contacting the department that issued the loan. Small businesses owners, including restaurants, seasonal tourism operators, and service sectors impacted directly by the pandemic, will be eligible for loans up to $200,000. They will not be required to pay principal on their loan for up to 12 months. We will also provide working capital in excess of $200,000 to help medium to large employers manage the impacts of COVID-19 on their operations. This will apply to manufacturing and processing industries, information technology sectors, full-time tourism and tourism service operators, business-to-business service sectors, engaged in export or import replacement activities, and cultural enterprises. They will not be required to pay interest or principal on their loan for up to 12 months. Businesses can apply directly to Opportunities New Brunswick for this support. We will continue to closely monitor and assess the economic situation, and if additional actions are required in the future, we will respond accordingly. Les entreprises peuvent présenter une
Businesses can apply directly to Opportunities New Brunswick for this support. We will continue to closely monitor and assess the economic situation, and if additional actions are required in the future, we will respond accordingly.
Financial hardships due to the pandemic. Others have shifted their production to provide different products and services that are currently in high demand. Opportunities New Brunswick will be working with New Brunswick companies to identify these opportunities and support the diversification or production wherever possible. We announced earlier this week that public safety officers found only 43 of the 762 businesses they had checked across the province that were not complying with recommendations from public health. I'm pleased to say that officers have since followed up with these businesses, and all 43 were found to be in compliance. These officers are continuing to patrol businesses across New Brunswick and are following up on any information they receive about potential cases of noncompliance. I want to thank all New Brunswickers who are continuing to do their part by listening to the advice of public health, by staying home as much as possible. Our province is under a state of emergency, and we must continue to comply. I want to remind New Brunswickers that we now have checkpoints set up for screening at all of the interprovincial borders. I know this is an inconvenience, but these measures are essential to protecting New Brunswickers. All interprovincial travelers, as well as those who have traveled internationally, must self-isolate for 14 days and avoid contact with others. These additional steps will help protect all New Brunswickers and will help in our goal of flattening the curve. Please continue to do your part and keep everyone safe. Nous demandons maintenant à tous les
All interprovincial travelers, as well as those who have traveled internationally, must self-isolate for 14 days, and they must avoid contact with others. These additional steps will help protect all New Brunswickers and will help in our goal of flattening the curve. Please continue to do your part to keep everyone safe. Thank you.
Thank you, Premier Higgs. We will now proceed with questions from the media. Nous allons maintenant procéder aux questions des journalistes. I'd ask each reporter to limit themselves to one question. Je demanderai aux journalistes de se limiter à une question.
I ask all reporters to limit themselves to one question. Would it be possible to have the questions in French as well?
J'ai mal compris.
I didn't understand. So I was asking if it would be possible to have answers in French. Yes, if you ask your questions in French, they will be able to answer in French.
Now that the federal government has invoked the Quarantine Act, how will this be policed and enforced in New Brunswick, and how should New Brunswickers report people breaking mandatory quarantine?
So we'll continue to work with the federal authorities, and who becomes quarantined or not, they would notify our public safety officials. At this point, you know, at all border crossings, we have people in place that are monitoring both the activity and the clients. So we would expect to get a report from the federal authorities of a particular case, and then we work through that with our Department of Health and Public Safety.
Adam Huris, Brunswick News.
My question is for the Premier. Premier, are you aware of any government departmental staff who remain in another country, and what is your message to them?
Well, I'm not aware of anyone at this point that is remaining in another country. I guess we've had people return that are isolating now, and so we're not able to come back to work, or we told them they weren't able to be here and they're self-isolating. But my message at this point is that it's going to be difficult for them to get home, and it would seem that is they've probably already realized that. They are able to I think connect with global affairs in Ottawa and actually look at alternate arrangements or possible arrangements. We won't refuse someone entrance into that's a resident here to come back to New Brunswick, but obviously they will be directed and required to self-isolate.
Laura Brown, CTV.
Hi, Premier. I'm just wondering if somebody was driving from Ontario and trying to get to Nova Scotia where they actually live, can they do that? Will they be get to the New Brunswick border and willing to give all of the information they have over to the checkpoint, but then able to continue driving through to Nova Scotia with the understanding that they would self-isolate for 14 days on the other side?
Yes, they will be allowed to transit through New Brunswick, and I would guess when they get to the Nova Scotia border, they'll go through it all again, and then go to their home in Nova Scotia if that is the situation. But they will be able to transit through.
Silas Brown, Global News.
Hi, Dr. Russell. When you were speaking about testing earlier, you mentioned that the way in which the province is currently doing testing and will ramp up testing is the best way to try and conserve our testing resources. Is there any worry about lack of supplies or personal protective equipment, and does that impact our testing capacity?
So when I spoke about resources, I didn't mean just the testing resources themselves, but human resources in terms of follow-up and things like that. So when we look overall at any of the approaches that we're taking, it's always with that priority in mind, testing the right person at the right time for the right reason. And as each province goes through the different phases of the pandemic, switching from travel-related cases 100% to then 50% to then it completely shifts to almost 100% community transmission. Eventually, we'll still have the trickle in effect of some of the travelers that obviously with the Quarantine Act in place now and those people being having to quarantine when they come into the country. These things that are happening right now are really positive in terms of protecting the population from community spread and continued transmission. So right now I'm happy with how things are progressing. I feel like we do, again, as I said earlier, we're working really well with Horizon and Vitalité, and our concerted efforts as organizations has been quite phenomenal. And I didn't mention this earlier, but I meant to bring up that PEI has a new case, and we wanted to notify people in New Brunswick of that because this person had arrived at the Moncton Airport from an Air Transat flight TS 2553 on March 18th. 18th, and that had come from Punta Cana, Dominican Republic. So the person did not have any symptoms while they were traveling, but my understanding is that we need to notify the public of that flight. So people should be self-isolating right now anyway in New Brunswick when they come back from another country. So just confirming and reasserting that that is what people should be doing. Alors, juste pour répéter en français.
So just to repeat in French, there's a new case in PEI, and this COVID-19 case is a patient who traveled on a flight from Punta Cana on March 18, and it was an Air Transat flight, and it's TS 2653. And the person aboard this flight did not have any symptoms during his or her trip, but we just wanted to tell you that this individual was on that flight, and everyone who comes from another country are supposed to self-isolate for 14 days. So we just wanted to reinforce this message, but now you still have this information. Can you hear me? So the question is for Dr. Russell. I would like to know, do you fear a shortfall of N95 mask for the moment? So N95 mask, yes. So we are working on this with the Vitalité and Horizon Health Networks since the beginning of all of this and even before. So we have a lot of equipment, but to make sure that we have enough for the whole pandemic, this is something that we discussed a lot with both health networks to make sure that we will have sufficient masks during this pandemic. And if we need to order more, there are processes in place so that we can order more masks nationally. Around the world, there will still be a need to order more. Mathieu Roy-Como, Acadie Nouvelle.
Yesterday that renters should pay their rents when they can, even if they're not facing the risk of immediate expulsion. I was wondering if the government is looking into doing anything more for renters, and especially people who live in subsidized housing or handy housing and stuff like that.
Yes, Matthew, we are. In relation to anyone that is impacted, I think we're analyzing kind of the broad spectrum of the impacts and what it means to individuals to be able to have the appropriate shelter and have the appropriate supplies of food and be able to maintain their current situation and their health. So we will do whatever, as I've said before, we'll do whatever it takes in any situation to supplement any negative impact that people have experienced through this COVID-19 outbreak.
Kevin Bissett, Canadian Press.
A question for Dr. Russell. Dr. Russell, some transit unions in the region have requested that public transit services be restricted to people in essential services, particularly people that work in retail and healthcare workers, in order to avoid community spread. Is that something you agree with, or is it anything that you're looking at?
Those are good questions. I think that those kind of conversations should probably take place in concert with people at the Department of Health. But it's also, there is guidance around those types of things, as my understanding from the National Public Health Agency of Canada as well. But again, we can look into that further.
Jordan Gill, CBC.
Yes, this question is for Premier Higgs. Currently, only some of the New Brunswick borders to Quebec have blockades or checkpoints. For example, the Van Horn Bridge in Gambleton has blockades just up the road in the bridge in Flatlands. There's nothing set up. Can you explain why this is?
Well, we will be expanding the activity to cover all the bridges. I guess probably at this stage, we're getting people, accustomed to the checkpoints, accustomed to the questions, restricting the main areas of traffic flow that we would see coming into the province. But as public safety review this and monitor traffic coming through all entry points, we will enhance our checkpoints as necessary.
Andrew Waugh, Telegraph Journal.
My question's for the Premier. Premier, how did you come up with the $50 million figure? And one of the big questions is, with the federal money is, okay, it's great, all this money's being announced, but how quickly are businesses going to be able to access this?
Well, in our case, our money is put forward directly as a result of the time lags that we might be seeing from the federal government, and being able to have businesses, let's say, survive this on the short term until the federal government kicks in on a longer term. So in looking at the $50 million, I guess I wouldn't put so much on the number itself as I would in the service that we're offering. So the $200,000 in relation to a company to see that they have the ability to continue to operate or pay their bills. We've also put a request into the federal government that the money should flow directly to the business to allow the businesses to maintain their employment structure. And therefore, you don't get into you allow continuity not only to the business but to their employees, and we're waiting for that response. So our whole analysis of the gaps has been based on kind of where we need to fit in for either a longer term view, but certainly on a shorter term view, so people aren't getting through this hurdle and finding that, wow, I've got a long period here that I don't have any income, and I just can't survive it.
Elizabeth Fraser, CBC.
Hi, my question is for the Premier. We saw a lineup of vehicles starting at the Quebec border in Campbellton last night. How long a wait might people face before they can pass, and are you planning to increase staffing to shorten those waits for people?
We certainly will increase the staffing as required. I would guess that we're going to find, in many cases, a number of regular commuters. So little time and effort will be needed to check them every day. And so the lineup should automatically kind of get better because of that. And then you get into the checkpoint requirements for new visitors or new entrants and what that means. So I guess give us a little time to kind of iron out where the wrinkles are, but we don't want people to be delayed, and I won't put a timeline on it as such, but certainly we're not looking to delay people by hours. I mean, we're talking minutes here.
Clara Pasica, Times and Transcript.
Premier, many have said that the secure housing is crucial to stopping the spread of infectious disease, and many in New Brunswick have lost their jobs at this time. So it was notably absent from the budget a few weeks ago. Will you now be reconsidering affordable housing commitments in Moncton and other areas?
So certainly, as anyone is impacted from this event, we're reconsidering any additional funding that is required to deal with it, and the housing and shelters, appropriate housing and shelters would certainly be part of that.
Vicky Hogarth, did you have a follow-up?
I do. My question is for the Premier. I understand officers are patrolling for non-compliant businesses, but are they also looking out for price gouging? And if so, what are the penalties for unfairly profiting from coveted items?
Well, at this point, we're looking for compliance based on the distancing and the how business that shouldn't be running, if they are or not, and what we're seeing in that regard. But I would suggest that if we've been given commitments from certainly the major retailers, there will not be any prices increase in this time. We've given commitments in relation to the pharmacies, and I know there's questions about the 30-day prescriptions rather than a 90-day being filled, and so they're looking and waiving the additional fees that would be associated with that from the pharmacy. I guess if I learn of any people are thinking that's real, I find it very disappointing that anyone would take advantage of their friends and neighbors in a time like this. And certainly if they're in business and doing that, then likely they won't be in business very long.
Adam Heuris, Brunswick News. Did you have a follow-up, Adam?
Yes, please. Premier, do you have any firm timelines and I mean that by actual dates on your financial assistance for workers and businesses? The federal plan starts April 6th. So if you're coming before that, you have a firm date.
Yes, we do. And with the Red Cross, we expect that that'll be up and running in like maybe like tomorrow. We're dealing with them right now, and they have the network. And we're able to put money in their pockets. So we're hoping that the absolute latest that we're in business is Monday of next week, but maybe even this week at the end of this week.
Laura Brown, CTV. Laura, did you have a follow-up?
Yeah, Dr. Russell, I just want to clarify, if somebody comes or calls 811 and is able to describe very similar symptoms of COVID but cannot trace themselves to a travel-related case or traveling at all, will they be tested at this point, or is that something that's going to happen down the line as we ramp up testing?
So as we have expanded our definition of who is at risk, we've expanded it to include people who have traveled outside the province as well as outside the country. So just by virtue of doing that, we're expecting to see the numbers increase in who we're testing. And the fact that we are now doing sentinel testing in hospitals right now, we're expecting to see, again, our test numbers go up. And we are actively looking for community transmission. Once we find community transmission, then we will be shifting into testing more high-risk groups, as I said earlier, healthcare workers, essential workers, et cetera, in a graded fashion as we move stepwise through our approach. So as of right now, anybody who had been in the community who had symptoms that a physician was worried about, they had had conversations with public health and they would get tested. So that's been has been the case so far. And my understanding is that, again, with 811, they wouldn't meet that criteria, but certainly, again, we have this approach in place, again, to test the right people at the right time for the right reasons and those people who are most at risk.
Silas Brown, Global. Silas, do you have a question, a follow-up?
Yes, this one's for the Premier. When it comes to the Red Cross funding, is there a timeline on that? I've heard April 5th as an end date for that, or will that be extended?
We want to, well, certainly to get it up and running. I'm hoping that gets up and running tomorrow, but certainly by Monday of this next week. And the timeline, again, it's going to play with regards to when the federal program is actually up and running. You know, we have concerns that timeline is going to extend, so we want ours to be that gap to meet the needs of people when they need it, and ours will extend as required in order to, complement the federal one being in full service.
Mathieu Roy-Comeau d'Acadie Nouvelle, as-tu un suivi, Mathieu?
Do you have a follow-up question? No, thank you. Radio-Canada, do you have a follow-up question? Yes, please. My question is for the Premier.
Borders, how do we make sure, especially, that people follow the 14 days isolation when they are coming in New Brunswick? So concretely, what kind of measures we are putting right now to make sure that they will follow the 14 days?
Merci pour votre question.
Thank you for your question.
Details we're taking at the time of entry in terms of their place of destination, their names, their address, their phone numbers and contacts. So part of the public safety program is to not only have that information, but to follow up with them on a continuous basis through that 14-day period to ensure that they adhere to the isolation.
Jordan Gill, CBC. Do you have a follow-up, Jordan?
Yes, thanks. This question is for Dr. Russell. Yesterday, Horizon said it's considering setting up additional assessment centers in, quote, strategic locations. How many more centers do you think would be needed, and what types of locations are best suited to prevent infection spread?
So I would have to have that conversation with the RHAs. So again, we have been working very closely with Horizon and Vitalité. So within the Department of Health, those discussions are happening, but I don't have that information right now in terms of how things are going to be moving forward. But the fact that they are in continuing to plan and adjust as things unfold is very important, because again, we have to base our decisions on the data that we have in real time in terms of how things are progressing.
Kevin Bissett, Canadian Press. Did you have a follow-up, Kevin? Might have lost Kevin. Andrew Watt, Telegraph Journal. Did you have a follow-up?
Yes, I do, and this one's to Dr. Russell. Dr. Russell, you've spoken several times about ramping up testing, and I know you said you're hoping to get to 1,000 tests a day very soon. Can you tell us what your end goal is? Like, what's the number you're eventually hoping to reach? Is 1,000 a day the maximum capacity, or are you hoping to go higher than that?
So the end goal is to protect the healthcare system and healthcare workers, ultimately to be able to manage through the different phases of the pandemic and COVID-19. That's the ultimate goal, and to do that while trying to have some semblance of society and the economy being sustainable throughout. So that's the ultimate end goal. Saving lives, keeping people healthy, preventing extensive community spread. Because of the measures that are in place right now, nationally and provincially, we know that the travel-related cases are going to decrease. So all the testing that we've done so far, which are over 2,000 tests, and I think between yesterday and today we did 300, those are all related to travel cases, close contacts of travelers, and so those are the numbers that reflect the highest risk in the population right now. So once the risk to the population is not amongst travelers and becomes the population of a community transmission, then we will be shifting, as they've done in Alberta, to looking at who are the people that we need to protect with respect to how that spread can negatively impact the community. And by that I mean, we obviously wouldn't want this transmitted throughout hospitals and healthcare workers, essential workers, people who work in long-term care facilities, and essential workers. So the risk to the population will no longer be directly in the community. It will be protecting those people who work to sustain society while we go through this. And so in Alberta, the direction they've gone in, and the direction at the national level for other jurisdictions as well, is to, again, target the highest risk groups. So we're shifting from the highest risk groups being travelers to the highest risk groups being people who protect our health and protect our essential services and protect vulnerable populations with respect to institutions. So at this point in time, that's the direction we're going in, and however many tests we need to be able to accomplish that, again, we have the facilities, we have the resources in place right now to ramp up. My understanding is from 700 to even 1,000 tests a day if we need to, but again, we're not aiming to increase the numbers for an absolute number. We're aiming to increase the numbers in terms of what is going to best protect the public in terms of the outcomes that we are looking for. So it's not about 1,000 or 700 or 600. It's about what's the number that's necessary to test the people that are most at risk.
Elizabeth Fraser, CBC. Did you have a follow-up?
I do. My question is for the Premier, and I'm sorry, the connection is poor on my phone, so if I didn't hear this properly, please correct me. When does that, I believe it was the $900 supplement, when does that start exactly?
We are rolling that out now, so as applicants come in, we're ready to distribute that.
Okay, so as of like today?
Yeah, as people come in, that's right. And now whether we'll have any actual check go out for the first of the week, but as we get clients now coming forward, we're in a position to start rolling it out.
Clara Pasica, Times and Transcript. Did you have a follow-up?
Yes, thank you. Well, we have heard from an advocate for refugees that says refugees claimants aren't entitled to the programs, including the monthly $2,000 payment announced Wednesday by the Prime Minister. Meanwhile, they're reporting delays in obtaining work permits. will the province provide refugees with any support?
Yeah, I would say that, yes, the short answer is as we will. Anyone that's here in our province right now that would have otherwise been working or had an opportunity to work, but is not allowed to do so because of this health crisis, we would be looking to ensure that they are protected as well.
That concludes today's update on COVID-19 in New Brunswick. Thank you very much. Voilà qui met fin à notre...
This concludes our daily update on COVID-19 in New Brunswick. Thank you.